They know what it's like to try and save a child suffering from a gunshot wound. And today, Louisville doctors took their stories to lawmakers, hoping to shape efforts to curb violence.
The mother of a teenager murdered in Louisville hopes testimony will impact your elected representatives who witnessed it firsthand. WHAS 11's political editor Chris Wims is joining us now with insight into what was said and reaction from the grieving mother.
Doug and Lisa, this hearing before a joint House and Senate Committee on Health and Welfare and Family Services called the issue a public health crisis. The opening statement delivered by a pediatric emergency physician grabbed the attention of all those in the hearing as she described moments at the heart of every parent's darkest fears.
I know what it is like to lead a team to try to save a life.
The panel assembled before a packed hearing room.
Sometimes we succeed and sometimes we do not.
Doctors, most of whom are connected to University Hospital.
I know how hard it is to watch a child bleed, cry, or worse yet, not respond at all.
With firsthand experience trying to protect and save kids.
I have choked back tears, trying to remain professional as I call a time of death, and look down at a tiny body. And I know the horrible, chilling, heart-wrenching wail of a parent who has just lost a child.
That detailed opening description by Dr. Britt Anderson demanded the attention of lawmakers. It was hard for anyone to turn away or avoid listening. Witnesses explained that 19 children are treated or die from firearms injuries each day in America. Annually, 1,300 children die and 5,800 are treated for firearms injuries.
82% of these deaths are boys. African Americans have the highest overall fatality rate, but whites and Native Americans have the highest suicide rate.
It's the third leading cause of death for children ages 1 to 17, the second leading cause of death for older children. Suicides and homicides rank high as a cause of death for older children as well.
My heart's been shattered into a million pieces, and every day you're trying to figure out how you can put them pieces back together. But in reality, you really can't, or it's a nightmare you can't wake up from.
Misty Tweedy has spent 13 months mourning, staring at an urn on the shelf in her living room. Her son Jericho was 18 when gunned down in Louisville last year.
No one deserves to feel the hurt to lose a child from murder, suicide, any kind of, you don't want to lose your children.
While not at the hearing, she's hopeful lawmakers will take to heart what they heard from those who testified and find something, anything that may lessen the impact of this public health crisis.
There is no miracle cure here, but we can and must do better. Kentucky must be a leader. Our children have a right to play, learn, and grow.
Louisville State Senator Julie Rocky Adams is a committee co-chair. She told me that no one event, no one piece of potential legislation inspired the need for this type of testimony. It was a chance for lawmakers to better educate themselves on the issue that's been the source of heated debate. Chris Williams, WHAS 11 News.